Hello world, welcome back to the Heartz of Matlock vlog. This week we're going to talk about heart disease, the different types of heart diseases, and their symptoms. In a part 2 of this video we'll do the causes and prevention to try to prevent those types. Today we're just going to cover the different types of heart disease and their specific symptoms. So heart disease is described as a range of conditions that affect the heart. Heart diseases include blood vessel disease, such as coronary artery disease, irregular heartbeats, heart problems you're born with. These are congenital heart defects, disease of the heart muscle, heart valve disease. So there are many forms of heart disease. So with the symptoms, we want to cover heart disease and blood vessels. So your symptoms for heart disease in your blood vessels, which would be coronary artery disease. You can have chest pain, chest tightness, chest pressure, discomfort, shortness of breath, pain in your neck, jaw, throat, upper belly, or your back, pain, numbness, weakness, or coldness in the legs or arms if the blood vessels in those body areas are narrow. So with coronary, you can have any of those symptoms there. Our next disease, heart disease, would be symptoms of irregular heartbeats. So some similar, you will have similar symptoms across these different diseases. Some have different that are specific to that particular disease. So with irregular heartbeats, you'll have chest pain or discomfort, dizziness, fainting or near fainting, fluttering in your chest, lightheartedness, racing of the heartbeat, shortness of breath, or a slow heartbeat. With symptoms of a diseased heart muscle, cardiomyopathy. So early stages of cardiomyopathy may not cause noticeable symptoms. As the conditions worsens, symptoms may include dizziness, lightheadedness, fainting, fatigue, feeling short of breath during activity or at rest, feeling short of breath at night when you're trying to sleep or waking up with a short of breath, irregular heartbeats that feel rapid, pounding or fluttering, swollen ankles, legs, or feet. Heart disease symptoms caused by heart valve, which is valvular heart disease, chest pain, fainting, fatigue, irregular heartbeat, shortness of breath, swollen feet or ankles. So with all these diseases, the symptoms will vary, like previously stated. So in actuality, when you want to see a doctor is when you feel anything different going on with your body. So I know a lot of times we want to just check off things to I'm just tired, or I haven't been getting any rest. So that sore back or that sore neck, I'll just get a heating pad or massage it out. I'll be fine. So as a person who lives in this example of advocating for yourself, I would recommend anyone just speak up, at your annual visit. So if you're doing annual visits once a year, if you're going every 6 months, whenever you do see your doctor, you always want to tell them and let them know what's going on, no matter how big, no matter how small. You may think it's something small, but then you also may not know that it's something going on in your body. You have no idea, so express that to your doctor. When you're feeling anything, any type of symptoms, any of those symptoms, or just feeling indifferent of yourself, that's not normal, express that to your doctor. So in my case, it was, yes, I have a family history of heart disease, but me personally, I've never got checked. So at the age of 33, when I went to my primary care physician, I just voiced to him that, I've never had my heart checked. I would like you to check my heart. And that ended up, starting a whole chain of events, and eventually needing heart surgery and getting heart surgery within a month and a half of me voicing that, advocating for myself to my physician. And in that, my cardiologist loves to say, you saved your own life. As a person who's still here, I want to thank God first and foremost, and just thank myself and my wife for having those discussions and just being well aware of voicing those concerns to your primary care physician. If I wouldn't have voiced that, who's to say if I would still even be alive or be here? I have two small children, beautiful wife. I'm blessed to still be here breathing for my family, my mother, my siblings. I'm blessed to still be here. All came from advocating for myself. I didn't have any symptoms. So with myself, I didn't have any symptoms. I was never shortness of breath, chest pains. I didn't have any symptoms or signs to say something was wrong with me. But in the interim, my body, in the inside, there was something totally wrong with an aneurysm on my aorta. So please advocate for yourself. Please speak up for yourself. Don't be ashamed. Don't be afraid to worry about you. There's nothing wrong with worrying about you. So health is wealth. I know that's a term that's used out here a lot, but health is wealth. So if you're not advocating for yourself, but you're standing up and being there for all others, there may come a time where you can't even be there for them because you were never there for yourself. And now you have something going on with you. Who's to say, you will have that same level of courtesy extended to you as far as being there for others? Would those others be there for you in your time of need? If you don't advocate for yourself, you would never know what's going on with your body internally, mentally, physically, emotionally. So my suggestion would be to always advocate for yourself. Any little thing that you see changing your body, please let your doctors know, and hopefully they would act and react in a way of concern. And no matter how little, how big, they would take action, appropriate action, to make sure nothing major is going on there. Stay safe, stay blessed. Part 2 about causes and preventions for all of these heart diseases and their symptoms. Part 2 will be coming shortly.